So with breast reduction, I will talk to patients about the risks associated with the procedure. And I can break them up into the scarring, the asymmetries that can occur, and most significantly, the blood supply or the vascularity to the nipple. So every breast reduction will incur scarring, and these can be scarring around the nipple, down the breast, and across the breast crease as well. Some patients will scar bad no matter what you do, and this is often a genetic predisposition. The majority of patients, however, the scars will fade over time. So scarring is an inevitable trade-off for getting an improvement in shape and a reduction in breast size and comfort. Now, the worst thing that can happen in a breast reduction is that the blood supply to the nipple can be compromised. That's why a surgeon needs to respect and preserve the blood supply to the nipple when we're elevating and lifting the nipple up to a high position. If the blood supply is compromised, you can end up with necrosis or death of the nipple. Thankfully, this is a very rare occurrence. The other thing that I would talk to patients about is the expectations of the final result. No breast will be absolutely perfectly symmetrical at the beginning, pre-op, or after the operation. And this has to do with healing factors as well, because during healing, some of the fat and breast tissue may shrink up a little bit more on one side compared to the other, may scar up more on one side compared to the other. As long as they're pretty close, then we will accept that as a good result. And the other thing I would tell patients is there is no guarantee of a cup size that you will get at the end of a breast reduction. Breast reduction is both a functional as well as an aesthetic procedure. So we will try to improve the shape as well as the size of the breast, but they will never ever be perfect.